Medical and Dental Benefits Overview. Welcome. In this video, we provide an overview of medical and dental benefits provided through LACERS. It is important to mention that once you retire, LACERS administers your benefits. This is different from when you were an active employee, when the personnel department administrated your benefits. One way we help familiarize you with your health benefits is through the Health Benefits Guide. The guide is your handbook for your health, dental, and vision benefits with LACERS. Once you are retired, this is provided to you on a yearly basis. It covers any changes occurring regarding health, dental, and vision coverage for the plan year. If you ever misplace the guide, you can always find a soft copy on our LACERS website. Who is eligible to enroll in LACERS medical and dental plans? You, the retired LACERS member, any eligible dependents, and even upon your death, an eligible survivor who receive a continuance or survivorship allowance is eligible for enrollment. As we investigate who is considered an eligible dependent, we begin with your legal spouse or domestic partner. Children under the age of 26, unless they are eligible through their employer. Disabled children who become disabled prior to age 26. And finally, grandchildren under the age of 26, if you are their legal guardian, have legal custody, or is the child of a dependent child. This is important to mention that is no requirement for full-time college enrollment for your dependent children. Health plan subsidies assist in the payment towards your health and dental coverage. Some requirements need to be met before enjoying these subsidies. To be eligible for a subsidy, you must be at least age 55, you must be receiving a service or disability retirement from LACERS, have a minimum of 10 whole years of service, and you must be enrolled in a LACERS-sponsored medical plan or be a participant in a medical premium reimbursement program. The medical subsidy chart provides a breakdown of the percentage of the amount earned, depending on your total service. Retired members are eligible to receive 40% of the maximum medical subsidy with 10 years of service. For each additional year of service credit, members receive an additional 4%. With 25 years of service credit, they are eligible to receive 100% of the maximum medical subsidy. Subsidy amounts are subject to change every year. For the most up-to-date amounts, please refer to the most current subsidy chart in the latest health benefit guide on lacers.org. The dental subsidy also requires that you are at least age 55 and have a minimum of 10 whole years of service. But there's an important difference as noted on the slide. LACERS does not provide dental subsidies to dependents or eligible survivors. What does this mean? It means that if you cover someone else on your dental plan, that premium will be deducted from your monthly retirement allowance. The maximum dental subsidies are listed here, and again, like your medical subsidy, it is based on whole years of service and maxes out with 25 years of service credit. Your monthly LACERS health plan deductions and out-of-pocket costs depend on the monthly premiums of the plans you choose, the number of dependents you enroll in your health plan, your dependent's Medicare status, and your LACERS subsidies. Different plans offer different benefits and have different costs. For example, if you are just covering yourself in an HMO plan, the cost will be less than covering yourself and a family member in a PPO plan. Your subsidy and plan offerings also change when you reach Medicare age. Again, Medicare is discussed in a separate video. As you can see here, the good news is that in retirement, you can still enjoy providers with whom you have been familiar throughout your career with the city. You can find out about the plan offerings by reviewing the health benefits guide. If you have further questions after reviewing the health benefits guide, please contact a member of the LACERS Health Unit. Before we go to the next slide, you will see that towards the bottom of this slide, there are Medicare plans. Why is that? Because upon turning age 65, you must enroll in a LACERS senior medical plan. Again, Medicare is discussed in a separate video. Something important to take into consideration prior to retiring is that your medical plan offerings do depend on where you live. Not all plans are available in all places. If you plan on residing outside of California or a different country, you must review the associated coverages available and accompanying premium costs. This slide breaks down the availability of plans options depending on where you might live. California offers more available plans, but that doesn't mean that you can't choose to live elsewhere. You can live in many places worldwide and have coverage of our Anthem PPO plan. Again, it is important to review plan coverages and costs as the PPO plans are more expensive than our HMO offerings. The dental plan you can choose also depends on where you live. If you live in California or selected areas of Nevada, you can enroll in an HMO plan. If you live anywhere else in the world, you can enroll in the Delta Dental PPO plan. Vision coverage is determined by the health plan you choose. If you have an Anthem United Healthcare or SCAN medical plan, you will have Anthem Blue View Vision. If you are enrolled with Kaiser Permanente for your health plan, then you will have vision through Kaiser. In all these cases, there is no separate premium for vision as it is already included in your medical plan premium. When you retire from the city and choose LACER's retiree health coverage, you will enroll as part of the retirement process. Coverage begins the first of the month after your retirement date, but there is no need to worry about any gap in coverage as your active city employee health benefits continue to the end of the month you retire. LACER's health plans are available to you if you need them, but you are not required to enroll. If you do not enroll at the time of retirement, you may enroll during open enrollment or if you experience a qualifying event. As a reminder, upon retirement, enrollment into LACER's retirement health plan is not automatic. You may enroll in the LACER's health plan within 60 days of your retirement effective date, and coverage will begin on the first of the month following your retirement effective date. If you do not enroll in the LACER's health plan at the time of your retirement, you may enroll during open enrollment or if you experience a qualifying event. What is considered a qualifying event? You may enroll or change plans within LACER's annual open enrollment, typically from October 15th to November 15th, 60 days after turning age 55, 90 days after turning age 65, or 30 days from moving zip code and or outside of the service area, having a change in family status, being involuntarily terminated from a non-LACER's medical plan, or a LACER's HMO plan zip code service area becoming available or unavailable. These are all considered qualifying events. To reach LACER's, you can give us a call, email, utilize traditional mail, or access our website. We look forward to hearing from you.